The Senate's back in session, and the first order of business is health care. Republican lawmakers are hoping to roll out a new draft of their bill to repeal and replace Obamacare by the end of the week. If all goes according to plan, they'll have a new Congressional Budget Office report early next week, and they'll be able to vote by the end of next week. But as many know, on Capitol Hill, things don't always go according to plan. Here's what Republican Senator Susan Collins said she heard about her party's health care plan over the July 4th recess.
Everywhere I went over the recess, people wanted to talk about nothing but health care. And everywhere I went, they were opposed overwhelmingly to both the Senate and the House version of the health care bills. They expressed concerns about what it would mean to the premiums and deductibles that they paid. They talked about the rural hospitals and nursing homes that are so dependent on Medicaid funding, and they were worried about losing coverage altogether.
Chief Congressional Correspondent Nancy Cortez is on Capitol Hill. So, Nancy, President Trump tweeted, "I cannot imagine that Congress would dare to leave Washington without a beautiful new health care bill fully approved and ready to go." Do lawmakers see 3 weeks as enough time to craft and vote on a new health care bill?
You know, some Republican lawmakers are keeping hope alive. They say that Republican leaders are now scrambling to come up with a new version of the health care bill that they'll unveil later this week. Possibly there could be a vote next week. But the main issue seems to be, Elaine, not time, but the fact that you have irreconcilable differences between moderate Republicans and conservative Republicans. And it doesn't matter how much time they have, they're never going to see eye to eye on the best path forward on health care. And because Republicans simply have so few votes they can lose here, they're just, many Republicans feel, never going to be able to bring the two sides together in a way that spells legislative victory. So you've already got some Republican senators, not all of them ready to throw in the towel here, but some saying perhaps it is time to look ahead to the next step, which would be working with Democrats on ways to shore up the individual marketplaces where people are seeing large premium increases and they're seeing a number of insurers leave the market altogether.
Well, Nancy, what's your sense? Did the July 4th recess help or hurt Senate Republicans make up their minds on health care?
There's no indication that it helped. You had about 10 Senate Republicans before the break who said that they were flat out against the current version of the GOP bill, and you've got about the same number now. What's interesting now is that beyond those 10, you have a number of Senate Republicans who are typically reliable, centrist Republicans who go along with leadership, who are also now saying that they're undecided. People like Chuck Grassley of Iowa, like John Hoeven of North Dakota. You know, when folks like that are saying that they too aren't willing to come down one way or the other, you know that they are reacting to a lot of opposition within their own communities. Susan Collins, who of course came out pretty early against this legislation, nevertheless says she tried to go to the most Republican parts of her state, Maine, over the July 4th recess, and she said she encountered almost no one, Democrat or Republican, who said that they wanted her to switch her vote and be a supporter of the Republican plan. She said universally she ran into opposition to the bill, and clearly when you look at the video of protests that you've seen here on Capitol Hill and around the country, these lawmakers, if they do venture out, if they do hold town halls, are running into a lot of very vocal opponents of the Republican plan, and that's clearly giving a lot of them pause.
The Trump administration has not had any major legislative wins so far. Is there anything else, Nancy, besides health care that Congress can work on and pass in the next 3 weeks?
Not really, because everything has basically kind of been on standby until Republicans could figure out what they were doing on health care. And the hope was that Republicans would be able to pass a bill, both in the House and the Senate, that would end up saving enough money that they could then apply to a big tax reform package. So if they can't pass that health reform bill, then that kind of messes with their tax reform plans as well. And it's also, not a huge boost of confidence for the party. This is something they've been saying that they wanted to do for 7 years, and they had no problem, by the way, voting to repeal Obamacare when they knew that it would never actually happen, that President Obama would veto it. Now that they suddenly have the power, you've got a lot of members who have voted very comfortably in the past to repeal Obamacare who are now saying, wait, let's put on the brakes. Actually, there's probably a more responsible way to go about this. If the party doesn't manage to do something that it's been promising it could do for 7 years, what does that say about its ability to then turn around and do something as complicated as overhaul the tax code?
All right, Nancy Cordes on Capitol Hill for us. Nancy, thanks.
You're welcome.